welcome back to Talk of the Town, and I'm so happy to have with me today Dr. Thomas Lenns from Heritage Medical Partners. Dr. Lenns, welcome.
Thank you.
And I think most individuals, most people like myself, we're not always sure exactly, who do we go see when we're not feeling well? There are so many types of doctors. You've got an internal medicine doctor, you have a primary physician, you have a family physician. How do I know where to go?
Well, good question, Sandy. Internal medicine is my specialty, and I'm considered a primary care doctor. And internal medicine means we are specialists in understanding the internal problems of the body. And we start with people at we start taking care of people in adolescence, about age 16, right on up until 116. And so we're essentially adult medicine physicians. And
you are able to see the gambit of issues. You can do blood work. You can get to maybe to the point where somebody would know if they needed to see a specialist.
Right. So usually we like to establish a relationship with our patient and have them come in, just get to know them. And you're right, we, in addition to wanting to check them out and examine them, we also have other testing that we do to find out what's going on internally, okay? Urine testing, blood testing, various lab work, because oftentimes things that are wrong don't necessarily show up when you're just being examined by the doctor.
Correct.
And these other tests, most people understand, they're going to go get blood work just to see if all is well. And we will find problems often that require a specialist to take care of. But usually we want to advise the patient about the need to do that, because it's hard for patients to think, well, do I have to go to a neurologist, or do I have to go see a surgeon? Where do I go first? So if they have us as their primary care doctor, they go to us first. And then many problems we can handle. But sometimes, or oftentimes, we have to rely on a specialist, and we help them make that decision.
Which is very important. It's a very important decision.
Right, because sometimes patients will go to a specialist and they didn't need to.
Right.
And they went on their own. So it's preferred that...
You're kind of the starting point then.
Exactly. We're considered kind of the captain of the ship, okay, where you want to be able to coordinate to where patients go. Because, patients go to specialists, and the specialist gives them some medication, and they may go to another doctor, and they may give them some medication. But without a primary care doctor to monitor all this, oftentimes there's problems. Well, wait a minute, that drug doesn't go with that drug, and this doctor doesn't know that that doctor gave the patient this drug. So with us being the overseer of all, we can coordinate things so that there are not problems of drug interactions, that kind of thing. We want to make sure that those kind of things don't happen.
And I think a lot of times people are thinking in their minds, I feel okay, so why is it I have to go for, say, a physical checkup? But there are a lot of really important reasons to do that.
Right, we get that all the time. We get those kind of questions, particularly from our younger people, our younger middle-aged people. They feel great, and they've come in to see us, and then time goes by, and they got a checkup, and they were okay. And then time goes by, and we haven't seen them. So we generally give them a little jingle, hey, we haven't seen you in a while, and it's time to come in. And then people say, well, I feel fine, doc, I'm okay. But our job is to be able to tell people after we check them out. They love to hear us say, you know what, you're okay. You look great, your health is fantastic. But in order to say that, we need to be able to check them periodically.
Right.
Because we want to find if there are problems, and there are problems out there. People are going to have problems. We want to find them early before it's serious. And so since we've found so many problems in so many patients over the years, by seeing them periodically and by being able to check them and be able to test them, we find things like, for example, like diabetes. I mean, diabetes is a devastating disease if you don't control it. And patients will come in and they will feel fine, but they're diabetic. And unless you start treating it early, you won't be able to control it well enough to keep them healthy. And there are many internal medicine diseases like that. You know, I mean, hardening of the arteries, plaque buildup in your arteries that causes heart attacks and strokes. Cancer, I mean, they're the two biggest problems in patients as they age. Heart attacks and strokes and cancer. And so many of those kinds of problems are found by periodically testing people and checking. And it's a lot easier to, I mean, there's so many wonderful cures for cancer now. There's so many wonderful medications to keep your heart and your brain functioning. And if you can start taking care of those problems early enough, you can keep people living to a nice ripe old age, which is what we want.
We certainly do. And Dr. Lenns, thank you so much for coming on the show. I appreciate it.
Welcome.
And please come back, because I think that there's probably so many other topics that we can touch on that so many people have questions about. And
Absolutely.
I know they can call your office to make an appointment. You're on Hilton Head, and
We are.
That's wonderful. And again, please come back. I'd love to speak more to you. And thank you for joining us today on Talk of the Town.